one.
Hi, I'm Emily Rachels, and my speech is on marijuana and can it be used for medical treatment. And this is my audience, my aunt, my mom, and my 3 brothers. So, medical marijuana is a recommendation by a doctor in the treatment of a medical condition. The difference between recreational marijuana and medical marijuana is the amount of THC that is used, as well as one is being used for medical justification. Marijuana is a medicine that works the best, but it is illegal. It is more helpful than it is harmful. It has helped in different cases such as cancer, seizures, and AIDS, as many other diseases. It is a natural plant to help people that are suffering. A 52-year-old man has suffered from a recent brain tumor that has caused debilitating symptoms for him on a daily basis. After months of different medications, he was prescribed medical marijuana and was now able to eat and be relieved from pain. Medical marijuana was passed in 1970. It dates back to the 28th century. 5,000 patients have received medical marijuana this far. They must receive a card in the state where the marijuana is legal, so they can't just go and get it in a state that it's not legal. They have to have a card and they have to have approval from a doctor. Marijuana is natural chemicals that are put into the body. The benefits of it are the use for chronic pain. It's helpful for seizure control. It's an appetite stimulant. It's also been used in many cases with patients who have cancer and are undergoing chemotherapy and don't have the ability to have an appetite to eat. And it also helps with the approval of life. Some other things that it does not intoxicate the patient like recreational marijuana does. And it has been known to slow the growth of tumors. So, the problem with medical marijuana is that there is no limited guideline for production. So, there's not a set regulation to say how much they can and they can't produce. There's not a correct dosing limits, which leads a lot of times to a potential overdose. It's the same way with the misuse of marijuana. And doctors feel that it is not ethically right for a patient to take this medicine. A lot of insurance also don't cover medical marijuana, and it is not monitored by the FDA. So it is good for heart disease and for people, no, it's not good for people who have heart disease, who are pregnant, or who suffer from psychosis. Some side effects of medical marijuana may be that they become dizzy or drowsy. They suffer from short-term memory loss and euphoria. So, weigh the risk and the benefits. One would have to ask themselves, if they find themselves in a painful situation with cancer or uncontrolled seizure activity, and there was a simple remedy that naturally works, would it take a rocket science to choose the solution for this problem? The quality of life for this is strengthened. The solution would be that we have congressional approval to pass this law for all 50 states to use the medical marijuana. It's, like I said before, better treatment solutions. We can educate medical staff and patients on the use of medical marijuana because it would take a lot of opiates out of the system and a lot of opiate overdoses that we have. And then we could do a conduction of more studies to show why it is beneficial and what is beneficial about it. So I put in my PowerPoint a graph that shows some studies of patients of pain management before medical marijuana and then after. And like I said, it was a decrease of opiate use and increase of medical marijuana pain control effectively. This is the study that was shown that they were able to decrease opiate dose and show how it starts to the preferences for those to cannabis instead of opiates. So in conclusion, like I said before, the quality of life is much better. It improves functions of the patient with no pain, appetite control, appetite increasing, and they have a better life and a better chance at living pain-free. What am I?